What's up, guys? Welcome back to the channel. In this video I'm going to be talking a lot about TRT and testosterone in general. This is my 6-month overall TRT review. So I'm going to talk a lot about the whole experience from the beginning to the end, so please be patient with me. There's a lot of valuable information, I believe, because I had tons of questions, didn't know anything about anything, and now I feel like I'm an expert. Although, keep in mind, I am not an expert, and this is not medical advice. This is just my own experience, so please don't do what I do. It's just for you to understand other people's experience. So, let's get into it. I just want to let you know, so from the beginning, how this all started. Over the years, my libido was dropping. Okay, I'm 39 years old. I noticed my libido dropping since my early 30s. I thought it was just me because I was like with my, when you're with your girlfriend, the first year, you feel like you can have sex every day, and then a couple years go in, now you're doing it every other day or every few days, and eventually you're there with them for 10 years plus, and your sex life is drops over time with the same person. Depending on your sex drive, everybody's different. But some people say they get no sex, right? Especially after they get married. Well, that wasn't the case with mine. It was just more libido based. But my libido dropped. So um, I would try to aim to do it 3 times a week at some point where it was kind of like leveled off there for many years. And then I I started bulking. I started to get back into working out again, lifting weights, all that good stuff. And I noticed my libido was kind of going down. And I wasn't cutting, I was just lifting weights, and it just kind of went down a little bit. But it was still there, but it was kind of lowered. Then I decided to start cutting and start shedding off some fat that I gained. And that is when my testosterone levels must have dropped even more down below the threshold where my libido flatlined, where it could be weeks before I even had the desire to have sex. Um, Now, this is when I went to my local clinic. All right, I started looking it up. What do I do? What do I do? There's TRT, there's enclomiphene. I was scared of shots back then. I was like, I don't want to do the shot. Don't want to do the shot. So what I want to do instead is I'm going to take the pill, the enclomiphene, which I learned that also increases testosterone naturally. Um, so I go to my local clinic, and they put me on 12.5 milligrams of enclomiphene 3 times a week. Now keep in mind, I got tested twice for my total testosterone just to double check. And the first time was with my general doctor, and it came back at 379. He says, "Oh, you're fine. Just keep doing what you're doing." I knew that wasn't fine, and I heard that doctors will just kind of push that off, and they just don't really care. They're not going to prescribe you anything. They're just going to tell you you're normal. They don't know much about it, so I guess it's not their fault. So I took it in my own hands, and I went to a TRT specialist clinic. And, they want your business. They want you on TRT. Doesn't matter if you're at 700. They're like, "Oh, we need to get you to 1,000," which is okay. They want you optimized. So I went there, and they're like, "We could get you on TRT, but if you want, instead, how about we start off with some enclomiphene, some pills that will increase your testosterone naturally." So again, I went from I got tested with these guys. I went from 379 to 300. So I went down, and this is with me bulking now at this point, thinking that's going to help correct it. It went backwards. So then I got the 12.5 milligram enclomiphene 3 times a week, got tested again. I'm now at 438 total testosterone. Not enough. Then they bumped me up to 25 milligrams. I end up leaving them because they're like an hour away from me. I just didn't like the way they were poking me. Their nurse, just, I don't know, she would just poke me more than twice to get my blood out. She just couldn't get it right. So I just was like, I got to go somewhere else. I ended up going online. Peter MD is who I use, and it's been the best ever since, because now I could go to my local Quest lab 5 minutes away. I deal with everything virtually. My doctor's virtual. He'll just talk to me. They're knowledgeable, but you got to learn about this stuff yourself, I recommend. They're just there to prescribe you and not let you kill yourself, which is good. You know, that's the most important part. But you gotta learn about some of this stuff on your own. So they gave me the 25 milligrams, and I started taking that 7 days a week. I got tested at 676 now. I'm like, okay, it's going up, but I still don't feel no libido. I don't feel much changes overall. And my biggest symptom then was the libido. Then, from the 25 milligrams every day, I now got added on to HCG. It's a little shot you put in your stomach. It produces more testosterone, and that got me up to 820. Okay, so now my total testosterone's at 820. I'm doing pretty good now for my age, right? But I don't feel the libido returning. So I'm just like freaking out. I'm like, man, what is going on? Is it something else other than testosterone? You know, is it my estrogen? I got on estrogen blockers, like an anastrozole, and I was just trying to figure it out, and it just wouldn't come back. So they said, why don't we try TRT and try to get you up to the optimal range of 1100? So I got on TRT. They start me off on a lower dose, which is 0.4 milligrams. Sometimes that could be a high dose for certain people. For me, I'm just not a good responder. I need the higher dose for everything. So 0.4 for me, which is 80 milligrams of cypionate testosterone twice a week. Got my blood test again. I came at 880. I'm just like a 40 to 60 over my enclomiphene protocol. So now I'm like, okay, this is crazy. So they said, we're going to increase you again. We're going to put you at 100 milligrams twice a week. So I know that's going to put me up closer to that 1100. So I get on that. I don't really feel much different at first, but then after several months of experimenting with this here, I remember the first few months I was on it was about the first 3 months I was doing the 160. The last 3 months was the 200. And by the 5th month, which is 2 months in with the 200 milligrams, something finally came together. And I started actually feeling my libido returning. It just came back 1 week and it stuck. You know, every time I got a little something here and there throughout the whole time, but it was never permanent. This time it became permanent, and knock on wood, it's back. My libido's back. It's not raging right now, but it is definitely back enough that I can at least have a normal sex life. I'm still working on different doses. I'm going to increase the dose eventually. Maybe go to 250, 300 maybe. I'm not sure. I'll definitely be posting videos about that as well. But overall, this is where it's gotten me. By the way, testosterone, TRT. I was afraid of TRT. I was afraid of shots and everything. Once I went online and I started getting my testosterone shipped to me, I started off with the 1 inch needle, where I would put in my quad or I would put in my shoulder, mainly the quad, the outer quadrant. You'll have to look up the placement for that if you want to know, because we're not allowed to tell you where to do it. I could just tell you that's where I put mine. I haven't tried the glute yet. I eventually will. I'm just taking my time. The 1 inch needles were a little intimidating, and I got used to it, but my friend also is on TRT, and he told me about these 1/2 inch needles, and they're so much better. So they're less intimidating. 1/2 inch needle instead of a 1 inch needle. I do it like deep sub-Q, which is like deep in the fat. Sometimes it kind of reaches the muscle depending on the area I poke in. So it's fine. Overall, now I'm like, okay, I might actually be on this for life now, because I can deal with the poke. I got over my needle fears. It's been good overall. So from the beginning to the end, from the very beginning, remember, my main symptom is my libido. It wasn't really energy. It wasn't a lot of other things. It's weird, because a lot of people, depending on their context, right, they come from super low testosterone levels. They're tired. They can't sleep. They're excess fat. I didn't have any of that stuff. So me, it was all about the libido, just trying to get that back. So I didn't get as many benefits as some other people would or will. I definitely did benefit in all aspects. It was just very small, at least that I could tell. Maybe it happened so slowly, I don't know until I'm off of it. But I feel good. I know that me being such low 300 total testosterone, there's no reason for me to get off of testosterone, because as you age, your testosterone decreases. I don't want to have to get off it to get back on it later. I want to reap all the benefits now, all the way to the day I die. It is what it is, and it's not like super expensive. It's like $100 or less if you go with Peter MD for testosterone. They ship you everything. I mean, the only thing you might need to buy is like some cotton balls for the blood when you do bleed, and also where do they put it at? Yeah, they're basically alcohol wipes. So that's all. It's like $1 at the dollar store. So it's pretty darn cheap. Under $100 you can get everything. So overall the experience has been good. My energy levels is fine. It probably improved a little bit. My mental health has been pretty well. It's got me making YouTube videos again. I don't know if it's because I have a subject to talk about finally, or is it because I'm just getting more motivation, And then as far as muscle, that's another thing I'm sure everybody's curious about. It makes you, it's not like those steroids that just make you just blow up. I did not change much. My current physique is just from hard work, from eating a lot of protein and knowing what I'm doing. But to be fair, I'm pretty sure I gained a couple pounds of muscle and lost a little bit of fat, a body recomposition without trying too hard. That's the big thing about testosterone, is you don't have to try as hard. You can keep your current physique. So maybe if I was going 4 days naturally, compared to the person, me, with testosterone replacement therapy, could maybe go 2 days and get the same result, potentially. But yeah, I'm still doing my 4 days. I'm trying to go beyond my current physique, and maybe after, if I increase the dose up to like 300 something, maybe I start getting blowing up, maybe, and you're gonna see that on this channel if I do. Right now I'm at 200. I just don't respond as good as others at 200. They might blow up at 200, But so again, it's like, it did give me muscle. It makes things easier. It helps with your cut, because when you cut, you start to be tired because your testosterone levels drop when you cut. Not when you're injecting. You're injecting in your body, you got full testosterone. So, but yeah, that's pretty much the sum up of my 6-month TRT review. It's been a good experience overall. It's not something super significant. I achieved my main goal, the libido, right? Another thing is, I ran into all those trials and errors where, is it the testosterone? Is it just because I started eating at the same time differently, started taking different vitamins, started stretching, started praying, started meditating? It's like, because I got new natural deodorant that's not interfering with my hormones? What, you start thinking, could it have been something else? And it's always possible, but I'm going to link this libido issue to TRT. And overall, I feel good. I haven't felt bad. Less moods, less tired phases, things like that. So I'll try to make some new videos next week, something else. This was more of a generalized TRT 6-month review. If you guys have any questions at all, don't hesitate to reach out. I will answer them. Yeah, thanks for watching, guys. You have a good rest of the day.